Surgical pathology quiz number 1. First case is a 42-year-old female, 3 months bleeding, enlarged uterus, 4 cm friable mass protruding through the cervix after previous attempt of ablation. Endometrium showing chronic endometritis, and this is a picture of the mass. Diagnosis: inflammatory pseudotumor. I did ALK, that was negative, so I strongly suspect that this may be associated with chronic endometritis and previous attempt of ablation. Next is a 60-year-old man with 1 cm well circumscribed brown nodule at the tail of the pancreas. Predominantly insular, no mitotic figures. Ki67 proliferation rate was 2%. Immunohistochemistry, synaptophysin positive. Your diagnosis is pancreatic low-grade neuroendocrine tumor. Next, 70-year-old man with 0.8 centimeters polypoid sessile nodule at the bladder to rule out papillary carcinoma. First thing you notice is that the urothelium is well preserved with the umbrella cells, a lot of lymphocytes and plasma cells, and this kind of dilated tubular structures with cubic epithelium and eosinophilic material. Diagnosis: nephrogenic adenoma. Next is 70-year-old man with 8 cm cecal mass, poorly differentiated carcinoma with lymphocytes, MLH1 negative in the tumor, PMS2 negative in the tumor with good positive control in the epithelial cells and lymphocytes, MSH2 positive, MSH6 positive. Diagnosis: medullary type carcinoma with MSI positive and lost MLH1 and PMS2, probably related with sporadic damage related with MLH promoter methylation and BRAF positive. Next case is 21-year-old female with oral contraceptive pills and 5 mm nodule in the endocervix, well circumscribed. You see this microglandular structures and this kind of signet ring cells. This is the entire formation here highlighted with cytokeratin. Your diagnosis is microglandular hyperplasia. 60-year-old woman with 1.5 cm well circumscribed parotid nodule, very well circumscribed, strongly eosinophilic, and here you can see the parotid, normal parotid, the capsule, and the neoplastic cells. Diagnosis is oncocytoma. Next, a 77-year-old woman with 2 cm solitary pancreatic mass, 3 H&E slides. Probably the most representative area is this here, with some kind of necrotic background and micropapillary structures. WT1 strongly positive, nuclear positivity, P53 strong nuclear positivity, PAX8 strong nuclear positivity, and highlight these papillary structures, and cytokeratin 7 positive. Diagnosis: serous carcinoma metastatic from ovary. This is a lady with history of serous carcinoma from the right ovary 2 years before. Next is 50-year-old woman with cirrhosis, ascites, and 6 cm solitary mass in the liver, showing this kind of macrotrabecular formations, very well highlighted with CD34 and positive for this immunohistochemistry, that is glypican 1. Diagnosis is hepatocellular carcinoma. Next, 70-year-old man with 1.5 centimeters ulcerated nodule at the chest, very highly cellular, kind of storiform, Ki67 90% nuclear positivity. Diagnosis is DFSP. I confirm this case with CD34. And the last case is a man with absolute lymphocytosis, multiple lymphadenopathies. This is a touch prep of one of the lymph nodes showing, I would say, 70% mature lymphocytes and 30% these big cells that I call paraimmunoblasts and prolymphocytes. Flow cytometry shows a cluster CD19, CD5 positive, also CD23 positive. So diagnosis is CLL, SLL with increase in prolymphocytes. We don't call this prolymphocytic transformation because we don't have the 55% prolymphocytes required in blood. So this is the end of the first surgical pathology quiz for Twitter and the Facebook. Thank you very much.